views and opinions expressed in this program are those of the participants and do not necessarily reflect the views of BronxNet or the program underwriters.
Good evening and welcome to Bronx Talk. I thought before today's show I would take a deep breath because when I look back at our calendar, I see that way back in March of 2020, it's almost a year and a half ago, we began doing these virtual broadcasts because we were locked down. And basically in the Bronx and of course across the world, we've been through the ringer with this pandemic. And there are a whole host of issues that have come along with it. We kind of have been on the roller coaster. Cases went down, cases went back up. We had the Delta variant. And of course, we had the vaccinations, which are really an extraordinary development of science and magic. But of course, everybody's not vaccinated. And then, of course, we do the analysis and find out who is vaccinated and who is not. While the numbers are currently trending downward, there's still a lot to talk about, especially in the Bronx that has been so affected by difficult health outcomes. So we thought we would do that on Bronx Talk and bring in three experts to join us. So I want to welcome our expert panel from the New York City Department of Health and Mental Hygiene. She is the Assistant Commissioner of the Center for Health Equity and Community Wellness in the Bureau of Health Equity Capacity Building. And it's our pleasure to welcome Dr. Olusimbo Ige. Nice to have you with us, Doctor.
Thank you. Thank you for having me.
And from a grassroots organization that said, you know what, and we were talking about this before the show, if they're not going to do it for us, we're going to do it ourselves and we're going to work together. And that's Bronx Rising Initiative. And so the managing director is Cyrille Njikeng. Mr. Njikeng, nice to have you with us.
Thank you so much for having us.
And we're going to, a little later in the program, we're going to meet Joe Wiederhorn, who is the president and CEO of the the Associated Medical Schools of New York, the AMSNY. And we're going to talk with her about some solutions to figure out how to get everybody to trust our medical institutions. So that's where we're at. Let's get started with you, Dr. Ige. We could talk about all the issues that we've had in the Bronx, epidemics in, diabetes, obesity, drug overdose, opioid use. I mean, we've been through, as I said, the ringer. Let's just talk about COVID. From your perspective in the city and in the borough of the Bronx, how are we doing right now? Are we getting where we want to be?
Oh, we have some good news, and we are very excited about how things are looking with regards to COVID. Right now, we have approximately 53 cases per 100,000 COVID cases as of October 28, 2021. That puts the Bronx in the category of substantial transmission, according to the CDC's classification. But the good news is those cases have been decreasing over the past month. So things have been trending in the right direction. But we're still seeing too many cases. So our hope is that we can get more people protected and more people vaccinated.
We just saw the trend as the numbers that we had put up. Those numbers were provided by Bronx Rising Initiative. Clearly, they're going down. With the Delta variant, the numbers are still trending down. Is it just an easy thing to say because more New York City residents are getting vaccinated, that's why the numbers are going down?
That is correct. We have very robust data right now to show the decline in hospitalization. As cases have increased, as vaccination has increased, cases have gone down, and hospitalization has gone down, and mortality has gone down. So we are very excited about that. If you look on our website right now, you see the summary. Everything is decreasing, everything is going down. So yes, we're very confident that as we see vaccinations go up, we see cases, hospitalization, and death come down.
We have some of the numbers for each borough. Citywide, receiving one dose is 73%. Not yet vaccinated is 27%. The Bronx, still on the low end, receiving one dose is 66%. Not yet vaccinated, 61%. That's obviously a concern. What are the issues that prevent Bronx people from all of them from this? Let's say Manhattan has got 82% have received one dose. Why do you think Bronx people are on the lower end?
There are a number of reasons why people are still holding out. Some people are concerned about the safety of the vaccine. Some people are concerned about the speed of the vaccine. Some people just feel, a lack of trust in the system and the government. And like, can I really trust that this vaccine is safe? So those are some of the factors. And we have been working really hard to get information to people, to share, the data around the safety of the vaccine, to elevate community stories and experiences so people see that others who live in the same community have been vaccinated and are doing well. So we are working hard with our community partners to get information to people so they feel more confident about the safety of this vaccine and that this vaccine is a good choice to keep them and their families safe.
I think that's a perfect segue to bring in Cyrille Njikeng, Mr. Njikeng, because you're talking about grassroots. Talk to me what Bronx Rising Initiative is and what your agenda is that really interfaces perfectly with what we just heard from Dr. Ige.
Thank you so much, Axelbank. I think the Bronx Rising Initiative is a program from the Oyate Group, which is a nonprofit organization. We are dedicated to providing and distributing critical resources to the Bronx because our founder, Thomas Ramos, who is a community activist, saw that it was difficult, during those period, March 2020, the looting were happening, the pandemic was going through, and we didn't have the resources that we needed. And he decided to go and look for funding and bring it back so that we as the Bronx Rising Initiative can be that, that gap bridge, be that bridge that will bring the resources to the community. And we've been doing that since. And to answer your question, we are that grassroots organization that's trying to do what other people are not doing. So the resources are not there. We bring the resources to our community.
Right, and work with whomever you can to listen. The outcomes are really all we care about. Now, we know what the city is doing. We all see the commercials on television. Those of us who are vaccinated, it's right. I got it. I know. But it's so needed. Talk to me about your methodology. How do you get out there in a different way to reach people who may not be able to be reached by some of the more traditional means that the city is using?
Thank you so much. That's an awesome question. We do grassroots approach, which is knocking at doors. So far, we're looking at 10,000 doors knocked at, in the Bronx, and over 30,000 vaccine given throughout our program. We knocked at doors, and it was just as Dr. Ige was saying, it was tough because the Bronx side were very skeptical in the beginning, and even in the middle part of it. Most people were not trusting of the process. They didn't trust of the vaccine. Some people were saying it's too early. Some people were not sure. We have documented interviews of people saying, "Oh, I don't believe in this. We're Black and we've been through it already. Now they want to experiment on us again." So it was a very tough process, but we were very, very focus on reaching as much people as possible where they are. So we have our team out there knocking at doors every day, making sure that everybody is registered to get the vaccine. Now we brought the vaccine in the community centers, in most NYCHA buildings. So we didn't expect people to travel far to go and get the vaccine. Right. We made sure that our partners brought the vaccine in.
Take away as many excuses as you can to make sure that now I saw this map and congrats to Dr. Ige and the Department of Health for having this very informative map. I think people in the Bronx would be very interested to know where in the Bronx people are getting vaccinated, where are they not getting vaccinated, and very interesting and unfortunate that right there in the central North Bronx, and that would be Wakefield and parts of Woodlawn, are really on the lower end of vaccinations. That's unfortunate. Congratulations to the people on the West Bronx. Let's leave that map up a little longer if we can. People on the West Bronx and the lower West Bronx are getting vaccinated at higher rates. And over there in City Island and Throgs Neck are also, and then the people in the Northwest Bronx are getting vaccinated. And we're still, in that 60 and 70% through the rest of the borough. I think that that's a fascinating thing because it doesn't fully follow the ethnic path that some people might say, or even the economic path that some people might say, especially if you look at Concourse Village in the West Bronx and then compare it to Riverdale and Throgs Neck, we know what the Bronx is about. I just think that it's a fascinating map. There's kind of a state of mind about, who trusts doctors and who doesn't. Before we bring Ms. Wiederhorn in, we have one more graph I just want to show, which it was provided to us by a Bronx Rising Initiative, but it really is from Department of Health website. So if you look here at the ethnicities involved, and then we're going to bring Ms. Wiederhorn in to figure out how we're going to address this. The numbers of Blacks who are not vaccinated are low, but frankly, listen, it's only slightly higher with white Bronx, New York City residents. This is a citywide thing. So it's just a fascinating look at that. Let's talk about what the Associated Medical Schools of New York are doing to address that very obvious discrepancy. Blacks are not getting vaccinated. And because I'm going to just say it, they don't trust the system. They go to a doctor who doesn't look like them. And they're like, you know what? We've been abused and beaten in every way, in every form. And this is another area that we're going to say, hey, you're telling us, but we don't believe it, even though the medical technology and the evidence is out there. So talk to me a little bit about what your efforts are about at AMS NY.
Well, we've been running programs to help diversify the physician workforce since 1985. Since 1985. In 1991, we started our first post-baccalaureate program. And these programs are for underrepresented kids who have applied to medical school, but have not gotten into medical school. They've gone through the application process, but the people on the admissions committee think they need another year and a half of academic study or mentoring, tutoring, that sort of thing. So they're sent to one of our post-bac programs. Our first one started in 1991. And if the students do well in these programs, they then have an automatic admission into the medical school that referred them.
So you're really paving the way to try and do this. This is not something that's going to be done overnight. I mean, let's face it, we got to have trained doctors. You don't want to have an untrained doctor or a nurse sticking a needle into your arm. We get that, but there is movement in this area. One of the stats that you brought out, it's extraordinary, and it explains the numbers that both Dr. Ige and Mr. Njikeng talked about. In New York State, approximately 31.1% of the population is Black or brown, but only 12.1% of the state's physician workforce is Black or brown.
Right.
And it's just a perfectly logical thing. I mean, and even though it's unfortunate and it's not helping us be healthier, it's an unfortunate thing.
It's very unfortunate. And over the past 10 or 15 years, medical schools have really begun to look at this issue and try to figure out what kind of programs they could offer that would help this. And so, as I was mentioning, we have these, now we have 4 post-baccalaureate programs. There are 17 medical schools in the state. Any one of the medical schools can send their students to one of these post-bac programs that we run. They all work the same way so that students don't have to reapply to medical school. They get directly into medical school. What's so important about these programs is it helps to provide a network of people, a sense of community among people that, they can do it. And they have the people who've already been through the program, mentor people, the kids who are in the program now. So these programs are really important to just lift up kids. They're entering medical school. As one person once said, it's like you're standing in front of a fire hydrant and they open it and the water comes pouring out. The amount of work and time and energy that it takes
to get to that point. Yeah, that's an extraordinary thing. For people who are watching and say, well, wait a minute, we're talking about COVID. Really, how do we address this, and how do we address people's hesitancy to take vaccinations? It's going to be a long-term process, but this is how we do it. We got to have doctors who, we've talked about medical discrepancies on this program for years with women and with people of color. This is the way to do it. Dr. Ige, I want to bring up another thing, and that is behaviors. And that gets into mask wearing. I was reading recently that the PBA is thinking of suing the city over mask mandates. You see this undercurrent of people saying, you know what, it's my freedom. I don't want to be told, not only with the vaccinations, but simply to put on a mask when you go into a store or something like that. My experience largely in the Bronx is that people get it and they want to be community minded and they want to work with each other. But we still hear, as I said, the PBA is getting ready to sue the city. We'll let the courts take care of what they take care of. Talk to me a little bit about your efforts, the department's efforts in just educating people and getting people to say, it's not the best. It's not your favorite thing to wear a mask. And I run out of the house. I say, I forgot my mask. I run to grab my mask. But talk to me about behaviors and changing people's behaviors to educate them that this is something that'll keep us all safer.
Sure. I think we need to start by acknowledging that most individuals want to do what is best for them and also care about their loved ones. So it's helping people to understand that this is the best thing you can do for yourself and for your loved ones to keep them safe. Mask wearing, it gets old after a while. Like nobody wants to wear the mask all the time, but we're still in the middle of this pandemic. Every time this virus has humbled all of us, every time we've let our guard down, it is snuck up on us. And this is a disease that has the potential to take hundreds of thousands of lives. We lost over 700,000 people in the United States in the space of 18 months. And over 34,000 New Yorkers have been lost to this disease.
It's just so heartbreaking.
Right. So this is more than any war we've ever had. So if we can prevent it, it's a little inconvenient. I think we have to do the best that we can to stop this pandemic and get life back to normal.
Yeah. Well, I just want to interject on that note, and I've mentioned this on the program before. You don't smoke when you go into a restaurant or bar. It's the law. And why don't you? And there are people who say, hey, I don't like it. They make me go outside and all that kind of stuff. Why don't you smoke? Well, number one, it is mandated. There is a fine for it right now. I don't know if we're fining people for, not wearing masks. But, you go outside and you do that, and you do that as a matter of course. You don't drive 95 miles an hour. You shouldn't on the highways. Why do you do that? Because you could affect other people. I have yet to understand what the logic is of saying it's an inhibition of my freedom. Why are somebody able to choose, this is the rule I won't follow and this is the rule I will? These are the guidelines, right? I mean, I'm preaching to the choir, I know, Dr. Ige, but do you want to add something to that and add the city's perspective on those kinds of things?
Right, that's exactly right. And public health is about looking out for the the health of the public. As long as this has a public health threat and the potential to impact someone more than yourself, then we have a duty to look out for the health of all New Yorkers. And that's where the requirements are coming from. And folks, once we saw Delta emerge on the scene and Delta took over, became 99% of all the cases we're seeing in the city, we couldn't stand by and let what happened in wave 1 and wave 2 be reenacted when we have a tool that can prevent that from happening. So we had to deploy all the tools in our toolbox, and that included, making requirement for people to be vaccinated so that we can all be safer and so that we can stop this pandemic. People feel imposed upon, but
yeah, we got, and so many Bronxites feel the way that we're talking, that they want to participate. Mr. Njikeng, I want to ask you about this, and that is children in schools. Now, we know that the children have not been able to get vaccinated. I believe Pfizer was just approved for 5-year-olds to 11-year-olds. I'm going to give you an anecdote, which maybe you can relate to, and because it involves Bronx parents. I was asked to run a workshop for Bronx parents, and they asked me if I would do it virtually or if I would do it in person. I said I would do it in person as long as there was some guideline at the door that people were going to be vaccinated. I didn't want to be in a room where we were going to run a spreader event, certainly with Bronx parents and our children. My goodness, I would never even consider it. And at that point, they said, then we're going to have you do it virtual. It was very disappointing to me because it suggested that many Bronx parents were still not comfortable with it. Do you have a sense about mask wearing, about behaviors, and what parents are thinking about in Bronx schools? Seems to me we just have to protect, especially with children being, vulnerable to the Delta variant. We got to protect them in schools. What do you hear from Bronx families and Bronx parents as regards their children in schools?
I believe the parents that we spoke to when we're knocking at doors initially to get vaccinated are the same parents who have children who are going to school now. Right. So if they were skeptical in the beginning and maybe they were forced in one way or the other to get the vaccine, what do you think at this point they're going to do with their children? They will not just say, oh, give vaccines to our children. Meanwhile, they themselves were struggling with the ability to get the vaccine. So there's that struggle. All we do as Bronx Rising Initiative, and as a Bronx parent myself, with that educational piece, the education piece is what we do, where we meet the parents where they are and bring them resources to educate them on why it is important that our children get vaccinated. Because my children go to school, and for the past 3 weeks, they've been home more than 4 times because there's been a positive cases in their schools.
Wow.
So it's very important that we as parents, even if we have issues, and this is the Bronx Rising Initiative, what all we do is bring in the resources. We're not here to judge people. We're not here to force you to take the vaccine. We just give you the resources, and we'll make sure that you make the right decision. And it's been very positive because the discussion back and forth with the community, at the end of the day, most of the people understand that it's important to protect themselves and protect the community. So we believe that those parents who are still struggling with letting this happen when the Pfizer goes down, and we've been having a lot of community events with the schools. Most schools are reaching out to us, please, we're ready. As soon as the Pfizer gets ready for the children, we want you to bring your team so that we can have vaccine at school.
And I'm thinking that if the school itself, if the vaccination is available, if the school itself works to schedule it and do that, we can do better. And I'm going to speak for Dr. Ige. She, I'm sure, appreciates the face-to-face, the one-to-one, which of course the city doesn't have resources to do. But if they see Cyrille Njikeng coming by, he's a Bronx father like I am. We talk the same language, right? That's how we do it. Let's just move around. I want to give a hopeful spin to this because we got to have hope. We got to see that we're going to get to the end. So let's go to Ms. Wiederhorn. Let's just talk about you getting scholarships. You're getting funding. There is hope to change the nature of the Bronx physician force. So talk to me briefly, if you would, take about a minute for some of the scholarships you're offering and what the opportunities are in medical schools. Albert Einstein College of Medicine is right here in New York State.
So we offer full tuition scholarships to students who are underrepresented in medicine and who've gone through one of our post-baccalaureate programs. This gives them enough funds to pay for their tuition and their fees, so they don't have to worry about that. But in exchange, they have to agree to work in an underserved area in New York State when they're done with their medical education. So, for instance, we've had about 6 or 7 students. The program's only been in existence for 5 years. And we've had about 6 or 7 students now who have gone to Albert Einstein College of Medicine. And
Can I applaud for that? I'm sorry. Nobody loves Einstein. My brother graduated Einstein.
So they've gone to Einstein, and they've come. 3 of them are still in medical school. 3 of them have graduated.
And if I just want to make sure there's time for everybody. If they want to get involved, if you have students, high school students, college students who want to get involved, who do they call? What do they do?
They can call any medical school. Every medical school has an Office of Diversity and Inclusion. They can call any medical school and ask for that office, and somebody there will help them.
Got it. Dr. Ige, I saw an article in the Times that said, how will we know when the pandemic is over, or are we always going to have this? My sense is that we can, they call it herd immunity, I don't care what you call it, that eventually we're going to be able to do it. What are you looking toward as a benchmark to say, you know what, maybe we ease off in the masks, maybe we don't have to have many commercials on TV about vaccinations? Is there a point, or you feel like it's just going to keep going?
It's hard to tell. We're hoping that we can get enough people vaccinated to stop transmission. But, we're Americans. We like to do what we like to do. So as long as the virus is still circulating, we have to be vigilant. This virus has humbled all of us. It has snuck up on us. Every time we've let our guard down, we've seen it come back even stronger. And the possibility of variants make us really cautious. So we're hopeful. The trend we've seen in the last couple of months has given us a lot of hope that there is a hope that we can get to herd immunity and possibly stop this pandemic and stop transmission. But it's still early days yet. We need to vaccinate more people.
I'm going to add an appendix to those words, and that is, this is a case where the word from the city is a really important word. When you were talking about health, let's follow that guidance. Mr. Njikeng will give you the final word here. Talk to Bronxites, tell them what you'd like to see happen and what you would like to take about 45 seconds to do that, and what your work is all about.
Thank you so much. We've been out there since March 2020. It's been a tough journey. We've been out there in the rain, in the snow, just knocking at doors, speaking at our neighbors, and pleading with them to do the right thing.
And when you do it, it's not coming from above; it's coming from your neighbor, right?
Yes.
It's so important.
And again, I'm so happy that you say that, because most of our team members at Bronx Rising Initiative are Bronxite. We're from the Bronx, and we do this because we care. We do this because we want to see a change. It all started because of this pandemic, and now we are doing food distribution. We'll be having a turkey drive for the Thanksgiving. We're doing scholarships for high schoolers, and we want to take it to the next level. But for us to do that, we have to be healthy. So we
have to do it together. I have to cut you off because we're almost out of time. After 9/11, a lot of people got into criminal justice. A lot of people decided they wanted to become police officers. I'm hoping now that the people are going to decide, number one, they want to become doctors, and Bronx people become Bronx doctors. My goodness. And then, of course, staying healthy. That's what we want. So Dr. Ige from the New York City Department of Health, thank you so much. Cyrille Njikeng from Bronx Rising Initiative, thank you so much. Joe Wiederhorn has been back for more. We appreciate your time from the Associated Medical Schools of New York. And guess what's going to happen? We're going to say goodnight. We're going to stay safe. We're going to wear our masks, and we'll see you next week. Good night.